When you've had ACL surgery, it can often be hard to actually feel and move like yourself again. So in today's video, I'm going to show you a very easy mobility routine that you can do at home, but hopefully give you some key tips and tricks to not make the most common mistakes that a lot of people make when it comes to getting more mobile post-ACL surgery. Because the problem is that you've been on crutches, you've been lying with your leg elevated, the lower back, the legs, everything just starts to ache. And often training will be the remedy for this. So when you start actually exercising, you tend to find that you feel more freer and you feel more flexible. But for some people, those aches and those niggles still seem to be in place, and doing a little bit of light mobility most days can be often really quite helpful. I'm going to take you through a typical workout mobility session that I would give to one of my patients, and I certainly do myself. But please, if you're following this at home, make sure you've checked with your clinician, your doctor, and ensure that it's something that is suitable for you at the stage of recovery that you're at, because everybody has different restrictions within their ACL rehab. So I always start off with a very standard quadricep stretch. Now, what a lot of people will get wrong here is they'll lean forward like this, or they arch their lower back to get straight because they're feeling it in the front of the thigh, or they just stand about and do it with no real intent. So what you're looking to do is just relax, find your level. If you feel down, there's your pelvis, there's your hip bone. You kind of want your leg to be in front of it, and to get a greater stretch, all you look to do is a very, very small lift with your arm and elbow. Rather than people swinging it and doing all this, you end up just pushing your leg back. You just hold this stretch, and you would hold it for 30 seconds. And then you would swap legs. And the same thing, this side's slightly tighter for me, and straight away I can feel that I'm already having to combat a little bit of my lower back going in. So I just find my neutral and just try to reset. And again, we hold this for 30 seconds. You might need to hold on to something for balance. And I'm just pulling my foot more into my bum and just trying to keep that knee, that leg, that thigh in a kind of straight position rather than wafting it all out there or bending forward. Okay, let it go. I would repeat that 3 times, so 30 seconds for 3 times. Then I would go down, and for this one, when you're kneeling on your ACL leg, you might need a bit of a cushion or a towel, and don't put the towel under your actual knee, just put it under your shin, because then what that will do is lift your knee up. This is for the hip flexor, so you get into this really nice, just natural position. Sit here, and then I will just start to feel, where can I feel it? And I have to lean quite far forward, but we're not shoving the back forward. Really important that as we lean, it's the front of that thigh that I'm stretching, and I use these arms just to help support my core a little bit. And I would hold it for 30 seconds, and then I would swap legs. And again, I just have to get into this position. Left side's tighter, I can already feel that's enough of a stretch. To increase this stretch, notice again that this is not going to make this stretch anymore on my body. When you want to increase the stretch, it's a very, very small tilt forward down the front of the thigh. So I can get a bit more out of this, but it's more stingy. And we're just holding this for 30 seconds. And again, you would repeat that one 3 times. The next one I like to do, and this is just a routine that I'm familiar with and that I like to do, I like to just sit on my feet, and this really stretches out the front of your feet. Also helps with that knee flexion, obviously. But I'm just looking here to rock over side to side. And I would stay like this for about 30 seconds. I often come out of this one and just put one foot forward and just try to arch it straight forward a little bit, just to feel it down the back of my calf and the Achilles. And it just puts you in that end range knee extension again as well. And then from this one, what I look to do is just bring a little bit of the lower back into it now. And I'm just stretching forwards because I think that that's one of the worst areas to suffer is the lower back. And as you can tell, I'm not very mobile at all. I'm not proud of it. But I'm tall and that's my excuse. But I would just hold this one for 30 seconds. And then from this one, what I always look to do is then just come forward. You should have more flexibility than I've got. You really want to be quite relaxed in this position, and I've held off for so long for doing videos like this because I'm just not that flexible myself, but I think everybody reaches their own level of flexibility and that's absolutely fine. I would do this one, always do this one a couple of times because it will improve. But I don't think flexibility is a sign of overall health or athletic ability. I never have, because I used to do all of the sports I've ever done and I've never pulled a muscle or anything like that. I just think it's my genetic makeup. That's my excuse anyway. Okay, so then we're going to attempt the cat camel, and what we're looking to do here is do it at the lower back position first. So you're dipping your lower back in first like this, and then you're looking to really round just the lower back for now. Squeeze your glutes and that'll help you do that in your core muscles. I would do 5 or 6 reps of this. And then what I would do is try to turn it into a full cat camel, bringing up the thoracic spine as well. So down we go. And then back up. Do as many as you kind of feel you need to do in this one. And then sometimes I'll just sit back on my heels, point my hands up in the sky just to stretch out my lats. And then just reset a little bit. So now I would look to do just a little bit of hip mobility. Just leaning forward and back. Just to see how the hips tolerate this. Of course, you would change sides by just rolling over like that. Might find one side's tighter than the other, so sit in the position a little bit longer. And then sometimes you can actually just keep rotating side to side like that, which I think is quite nice. And that really helps just to loosen off the lower back as well, for me personally. And then just a little bit more of the glute. So just sitting in this position. You'll feel the front of this leg and the back of this leg. And then you can get right down on the floor. I don't tend to find it really changes the stretch much for me. Change legs. You'll find one side's always tighter than the other, so just work at it naturally, what works best for you. Now I'm going to move on to hamstrings a little bit. And I just don't get on particularly well with just sit pulling at my hamstrings, so I try to go with something that's a little bit more kind of moving, dynamic, and just almost a bit of flossing. So what I do with this one is point my foot forward on the way down, pull my foot back, so towards my head, and once I hit a really nice point of resistance, point that toe back up to the sky, back down we go. And this has just always been the best way for me to stretch my hamstrings and just floss the nerve a little bit and just release some of that neurotension that we can get from the hips and the glutes and the lower back. And just change legs and you'll find you get more out of one leg than you do the other again. So toe upwards, and then as you go down, point your foot down. Really try to relax when you're doing this one. Okay, next one I would do would just be a little bit of a lower back rotation from there. As you can see, I don't have much rotating at all. I hope you've all got a lot better than I have. Back over to the other side, which is even worse. If I get killed in the comments for this, saying that I should be more flexible, then I'll regret doing this. But equally, I'm not going to ever pretend that I'm something that I'm not. And then back over and just work through that one a little bit. Sometimes what I'll do is just rock side to side, just to try to improve that. I think anybody who's had ACL surgery knows how difficult it is to keep your lower back feeling nice and nimble. Just rocking again. And then sometimes I will just do another bit of a glute stretch if I'm just feeling a bit rigid still. Just add a bit of thoracic rotation in there as well. And realistically, these don't take long to kind of put together and do. It's minimal effort, and I think it can just make you generally feel a bit better. But you couldn't be doing this every single day and expecting to feel amazing, because that's not the role of stretching. I think stretching has its place, don't get me wrong, but it's not a magic wand to curing lots of people's issues like I think a lot of people often think it is. Okay, so now just going to stretch the calves a little bit, and what I do is just get into that pike position, and then I'll just put my other leg on my calf just to stretch it out a little bit. What you can also do as well is just rock like that. And then normally from this one, I tend to just crawl it back up, stand at the top of the mat, see how things are feeling, have a little bit of a mini assessment. And then I would just work on more things that I'm just not feeling so good with. I'll just try to stretch things out a little bit more and see if I can improve things a little bit. But just do what you feel you can do. And I hope that you have found this video useful.